Good afternoon, everyone. Dr. Fitzgerald will be attending by phone today, so to get this media availability started, I now turn it over to Dr. Fitzgerald.
Thank you, Premier. Good afternoon, everyone. Thank you for joining us today. I'll start with an update on the number of cases in the province. Since the media briefing yesterday, we've had 23 new positive cases. All of these cases are within Eastern Health Region. The public health contact tracing is ongoing. Everyone considered close contacts will be advised to quarantine. The total number of cases in our province is now 175. By region, we have 166 cases in Eastern Health, 3 in Central Health, 1 in Western Health, and 5 in Labrador-Grenville Health. We do not have a new number related to Call's Funeral Home. However, yesterday, 120 cases were related to Call's. 55% of cases are female and 45% are male. By age, we have 13 people under the age of 20, 24 between 20 and 39, 29 between 40 and 49, 40 between 50 and 59, 36 between 60 and 69, and 33 who are 70 or above. 15 people have been admitted to hospital due to the virus. Of these patients, 3 are in intensive care. 10 people have now recovered. In total, we have tested 2,816 people. In Eastern Region, 2,108 people have been tested. Western Region has tested 289 people. Central Region has tested 218 people. And Labrador-Grenville Health has tested 201 people. Today, I have advised the Minister of Health and Community Services to consider extending the existing public health emergency order for another 14 days. To view the details of this order, you are encouraged to visit our website at gov.nl.ca/COVID-19. This is indeed an unprecedented time and one of uncertainty. If you or a loved one are feeling anxious or alone, please consider calling the provincial warm line at 1-855-753-2560 to speak with a trained peer supporter who is there and ready to listen. This service is available from 9 a.m. to midnight, 7 days a week. If you call and are prompted to leave a voicemail, a peer supporter will be quick to respond. If you are experiencing a mental health crisis, please call the Provincial Mental Health Crisis Line 24/7 at 1-888-737-4668 to speak with a mental health clinician. These services are available to support anyone who needs them. Please reach out if you need to. The fluctuating number of new cases we are seeing each day in our province is not unexpected, as we are still in the early days of this epidemic in Newfoundland and Labrador. As we progress through week 3 of the COVID-19 public health emergency and continue to adapt to this new norm, please rest assured that protecting the public is our highest priority. The measures we have implemented are crucial to slow the spread of COVID-19 in our communities, and they will save lives. Please continue to do your part. Remember to stay in your bubble. Protect your bubble, and don't break anyone else's. Go out only when necessary. Practice physical distancing and wash your hands frequently and well. Please stay at home if you feel unwell. Our collective actions will have significant impact on how COVID-19 progresses in our province. Thank you.
Well, thank you once again, Dr. Fitzgerald, and good afternoon, everyone. Today we saw 4 cases in our province. Today we saw 4 cases in our province, or 23 cases today and 4 cases just yesterday. As we've been saying, that this is not a time to be complacent. Yesterday was not a day to celebrate. So we went to 23 today from 4 yesterday, and this is the reason why we're taking this position. We must continue to abide by all the guidelines that we have set out, as Dr. Fitzgerald said, in this public health state of emergency. Your actions today determines the future for our province and our residents tomorrow. So let's be responsible and let's continue to work together to stop the spread. Now, speaking of working together, once again, I want to highlight and thank our all-party committee It's Ches Crosby and Allison Coffin, of course, our leader of the opposition and the leader of the third party. We continue to meet on a daily basis. We call every morning to discuss all issues of importance, and we are working together to find solutions. As I said, and we all say, that there has never been a more important time than now to put party politics aside and concentrate collectively to prevent the spread of COVID-19. Now, interesting enough, as I talk about the members working together, today marks the anniversary of Confederation of Newfoundland and Labrador. So what is evident by all of us who are working together, working with the same goal of protecting you and supporting you. So I want to thank Ches and Allison and members of our all-party committee for your cooperation and your dedication to the people of our province. Through working together, we have put a lot of measures in place to protect you and your loved ones. Now, speaking of recent days, there's been a lot of discussion around our efforts to facilitate childcare services for essential workers. These workers are critical to the operations for their employers and to government during this pandemic. Specifically on how we can provide a very safe environment while keeping within the advice of our Chief Medical Officer. Public Health advises us that during the pandemic, the preferred arrangement for childcare is in a home environment. Home environment would include family, it could be your trusted neighbors, it could be some friends. So with this in mind, a new program has been introduced for the provision of childcare services for essential workers. This will allow families to arrange their own care in a home-like environment. This is, as I said, the preferred option. So families that can arrange their own child care in a home-like environment will be reimbursed up to $200 per week per child upon confirmation from their employers that they are essential employees. The department has received approximately 800 applications from across the province. For approximately 50 preschool children requiring care outside of home-like environments. So we've received 800 applications in total, with 50 preschool children requiring care. So it is clear that the vast majority of our essential workers are already using the preferred option, which is the home-like arrangement. Or you have the ability to put such arrangements in place as needed. But again, based on the advice of our public health officials, that is the preferred option. Now, for some, a small few, this is not possible. So the program will also allow families to avail of an alternate arrangement in a safe, regulated environment with guidance from public health. The Department of Education and Early Childhood Development has already contacted child care centers. Minister War is leading this, and so we've contacted those centers regarding the need for child care for preschool-aged children. So we first matched the families with their current child care provider. So if they're receiving care before these operations were closed up, they can go back to those operators and put the children that have been going there in the past, connect them. So we will ask all operators of those centers that we are exploring options with. We'll be working with them to make sure that we connect as many families to those operators as possible. There is one other group, however, these are school-aged children, because the program goes up to age 13, that the department is now working with the English School District and the NLTA to utilize schools and substitute teachers who may wish to participate. All of this, of course, is to ensure that we have child care centers and family care homes that will not be overburdened. So we're exercising all the options that we have available to us. Of course, keep in mind that the appropriate physical distancing can be maintained if the demand increases. So the department today is finalizing these plans, and further updates will be provided in the coming days. But once again, the health and safety of our children and our families, the operators and their employees, and everyone who is involved in this service is paramount. So throughout the process, we will continue to seek advice and the recommendations of our public health officials. So what we're doing here is collectively all of us working together, because we know and recognize that essential workers, we need their support during this healthcare crisis. And all of us, we're all cheerleaders in the efforts of our essential workers. So we need you and all of us to support them as best we can so that they can continue to focus on their work. So I want to thank everyone who has been involved in working and to putting these measures in place, including our child care centers. It's by working together that we will get through this. There are many conversations, as you might expect, taking place each and every day as we continue to make decisions with you on your health and safety. So today I want to talk a little bit about a conversation that I would have had just yesterday, and this was with Chief Michel Joe. Of course, he's known throughout our province as a tremendous leader. They are putting measures in place to protect the health and safety of their members in Conn River in support of the guidelines that put in place and recommended by Dr. Fitzgerald. So if you're going into Conn River, you will come in and you will see some checkpoints for essential travelers only. And this is really to reinforce to everyone that travel within the province is only for essential travel. We also know that there are thousands of residents who are tuning in right now for this update. And we really do want to thank you, all of us, the Minister and our Chief Medical Officer, for joining us. So I want to take this moment that I hope you're doing well. I want you to know that we will do whatever it takes to support you through this health crisis. Many of you who are staying home and staying inside on the recommendations, you watch TV, you look at the stories, you feel stressed, you feel anxious, you see what's happening around the world as a result of this pandemic. So remember that as a province, we have resources available to support you. So I encourage you to visit bridgethegap.ca, and is there you will find the resources for both adults and for youth. We are there to help you. We are there to support you in your mental wellness. You are not alone. We're here for all of you. So it's by working together that we will see change. The time is now. Let's support each other as we work to stop the spread of COVID-19. So I now turn it over to the Minister Haggie.
Thank you very much, Premier. You've heard Dr. Fitzgerald's update today, and on the basis of that and her advice, I have again signed another state of emergency. The legislation only permits these orders to be made every 14 days, and this is another landmark. It was the first of its kind to ever be issued under our new legislation, and now it is renewed. Quite frankly, I expect to be signing this on a regular basis for some months to come. We are in for a long haul. We had discussions last night with my federal, provincial, and territorial counterparts about the situation across the country. And the experts are advising myself and my colleagues that this situation is likely to last beyond Canada Day in some form or another. And we are preparing for that as best we can. I've highlighted in the past some of the arrangements we have made, and I'm happy to go over those again at question time, should that be necessary. Our current concern, provincially and nationally, is around protecting our workers in healthcare, as well as the members of the public who have been exposed to this virus. And this relies on supplies and consumables that we have to bring in from outside. We are, just as the rest of Canada, seeking actively to make sure we have a steady supply of personal protective equipment. But quite frankly, there is a whole saga behind the scenes of inventory that doesn't exist, of orders that disappear, and quite frankly, of deliveries being purchased from underneath us at the plane by other jurisdictions outside of Canada. This is not peculiar to Newfoundland and Labrador. This was a common thread last night on the call. Nationally and provincially, we're working with business and entrepreneurs to try and repurpose our own manufacturing capabilities to allow us to become self-sufficient. We are cautiously optimistic that we will have those measures in place and that our supply of important personal protective equipment will continue. We have had representations from workers in the healthcare field who have traditionally been businesses and standalone organizations. And I'm thinking of personal care home operators and home care agencies and workers. There is a meeting today to see what can be done to strengthen our measures to protect those individuals who receive care at home and those who provide it, as well as supporting personal care home operators in best practices as to how to protect their residents and your loved ones. From the point of view of those patients, fortunately the vast majority of them with COVID-19 who are being looked after at home and are suffering from mild or moderate disease, we've been working hard with NLCHI and Eastern Health, and over the next few days we are repurposing our remote patient monitoring program to allow these patients access to monitoring at home by healthcare providers. And I hope to be able to provide updates on that in detail over the coming days. This is an important step to bring virtual care one step further into your own home using iPads and real-time biometric measurements. We've had questions about the pharmacy dispense fee, which has been a sensitive issue for people who are seniors or on low income. This decision was made by the regulators of the regulators of the pharmacists in the province on the advice of manufacturers. And it was done with the intention of securing drug supply. The unfortunate side effect of this has been a cost to our more vulnerable citizens. So we've worked with the pharmacists to ensure that for those seniors and those low-income individuals who we provide coverage for on the foundation and 65-plus plans, that while they will still have to pay a dispense fee every 90 days, the department will compensate the pharmacists for those other dispenses to minimize the financial impact on individuals. The virus does not discriminate between young and old, rich and poor, and others who live in rural areas or urban areas. And one of the things that's distressed me somewhat is that there does appear to be discrimination out in the communities in some areas for those people who, through no fault of their own, have contracted this virus. They are human beings just like every one of us, and they need to be treated with some kindness and some consideration. There are guidelines, and for those of you who follow them, each party will be safe, both those who have the illness in its mild form and those who need to supply services so these people can self-isolate safely. Yesterday, I was asked questions about the numbers of workers in the healthcare field who were in self-isolation. And once again, this is a point-in-time number, but I'm able to supply the information. There are currently 379 workers in the healthcare field across Newfoundland and Labrador who are in self-isolation. There's 264 in Eastern Health, 32 in Central, 48 in Western Health, 28 in Labrador Grenfell, and 7 who work for the Newfoundland and Labrador Centre for Health Information. Obviously, this number will change, and for those who were involved in the Dr. Fitzgerald's initial order of mandatory self-isolation that ends today, obviously some of these people will be able to resume work in the near future. Again, my message here is quite clear, and it's exactly the same as Dr. Fitzgerald's and the Premier's. Make a bubble of protection for yourself and your loved ones. Stay in that bubble, stay home, and don't go and burst anyone else's. This is going to be a marathon, not a sprint, but the time to make a difference is now, and the time to get it right is now. So I encourage you all to do your part. And with that, I'll throw it back to the Premier. Thank you very much.
So before I throw it back to the media for questions today, I just want to make one final comment. And this is about some concerns that we've seen about some false posts that are going around the province and around social media. Things like cabinet shuffles, things about extension of school years, and so on. This is April Fool's Day, as you know. This news, these posts are fake. They're in no way funny. So I encourage those who ever put this up to stop being a fool on April Fool's Day. It is irresponsible. It is completely unacceptable. Our focus right now is on the health of Newfoundlanders and Labradorians. So I ask you to, whoever is responsible to remove those posts, take them down. They are wrong. If those of you are looking for the trusted information based on the changes and things that are going on in our province, I would encourage you to visit our government.nl.ca/COVID-19. That's where you will find the information related to the decisions that we are making on behalf of you and making on behalf of your government. So I now turn it over to the media for today's questions.
Thank you very much, Premier. For the benefit of our speakers, we have 9 reporters registered for today's call. In the essence of time, each reporter will have the opportunity to ask 2 questions and 1 follow-up. We suggest that you not ask rumor or April Fool-based questions. We will run through the telephone queue, so each reporter is given an opportunity. Following this, should time permit, I will ask if there are any further questions. I reiterate that we have 9 reporters on the line, and we want each of you to be able to ask questions. This call will end at 2:59 p.m., and any further questions can be emailed. Operator, please proceed.
Thank you. Please press star 1 at this time if you have a question. The first question is from Peter Cowan from CBC News. Please go ahead.
Premier, how worried should Newfoundlanders and Labradorians be that the province has needed federal help just to borrow enough money in order to make payroll?
Not worried at all about payroll, and I've had messages from many pensioners across the province today as well. So we are indeed in a position to make payroll, and will continue to provide the services. Fortunately, last Thursday in the House of Assembly, we were able to get provision to go and borrow $2 billion. We've had some success this week in the markets, of course, supported with the Bank of Canada by the changes that they had made to help provinces like Newfoundland and Labrador with their borrowing requirements. So essentially, we can make payroll, we'll continue to provide the services, but like I've said, we are in a health crisis. Our priority is dealing with this pandemic, but coming out of this, we are entering into an economic crisis, and we will need the support of the federal government. We are unique, as I said so many times, unique when you compare us to other provinces. All my provincial premiers, they're aware of our situation. The Prime Minister has been working with us, and so is the Deputy Prime Minister, who we meet with on a regular basis, and certainly the Minister of Finance is acutely aware of where we are as a province.
I want to ask about RV parks and the order that was made yesterday by the Chief Medical Officer of Health. If it's okay to go to the cabin, why shut down year-round RV parks where people essentially use these as a cabin to get away?
So it's about being able to isolate if you get sick. If you're in an RV, that's not generally a possibility, or if someone's in a tent, it's not a possibility. Just really more to do with the congregation of people in those areas and the difficulty of keeping people apart and physical distancing. That was the main concern.
And what's the latest recommendation on face masks? We're seeing more people want to be able to wear them. We're even seeing some people in the community making their own face masks. Should people be wearing them when they go out?
Face masks are most effective, and we use them most often when somebody is outside of healthcare, when somebody is sick, and we want to prevent the transmission of the virus or whatever they are sick with to someone else. With regard to protecting yourself, while there may not be any harm with wearing a face mask to protect yourself, certainly medical grade face masks are the only ones that are certified to prevent the spread of these viruses. Homemade ones may not offer that same protection, especially if they don't fit well. But if somebody wanted to wear one, there's probably no harm with doing that. But it's it's not necessarily going to give you the protection that you think it will, and there really is nothing that would replace careful hand washing, making sure you either wash your hands with soap and water or with use an alcohol-based hand sanitizer. Make sure you don't touch your face, especially around your nose, mouth, and eyes, and physical distancing, and making sure that you stay in your bubble. So those are still the most important things to do.
Thank you.
Thank you. The next question is from Kellyanne Roberts from NTV News. Please go ahead.
Thank you. Daffodil Place is shutting its doors in the next 21 days. Is the province doing anything to help with this current situation?
From the point of view of Daffodil Place, that's a decision they've made. We will still provide hostel services for those people who require it for medical travel. The issue is that medical travel essential and necessary? That is a clinical decision between the patient and the physician. And again, bearing in mind that what may not be essential for a week or two over the course of 2 or 3 months can become an issue that the physician and the patient might want to have addressed. So we will be providing through Eastern Health for those people who need it, hostel services.
Thank you. The lobster fishery is set to open April 18th. Many of those fishers are wanting to know one way or another what the plan is for April 18th.
So the fishery, of course, is an important industry to Newfoundland and Labrador, and typically April is a month that people start preparing. So I know there's work and conversations and discussions ongoing if that could happen in a safe way, practicing the advice that will come from the Chief Medical Officer, things like physical distancing, proper hygiene, hand washing facilities, and so on. Recognizing that if you're a harvester, that's very difficult. If you're offshore and you're working in some extreme environmental conditions, that may be difficult. Likewise, for processors and plant workers, that would require some adaptation and some changes that would have to be made in that environment as well. So work is still ongoing, and still working with public health officials to see, what the future will be in this. It's probably a little early to say right now where this is. There's other conditions, of course, that we need to deal with. We have currency, we have markets, and access to these markets can be difficult given the current global situation. But work is ongoing. But when, if it does open, and we cannot make that determination yet, it will have to be in a very safe way to protect the workers that work in that difficult industry.
Thank you. And I'm wondering if we can get a breakdown of the 15 that are in hospitals. We know the region. I know previously when it was lower we had it. Not sure if that's still available.
The 15 inpatients you're referring to?
Yes.
Yeah, there's one in Central, one in Labrador, Grenfell, and the rest are in Eastern.
Thank you.
Thank you. The next question is from Patrick Butler from Radio-Canada. Please go ahead.
Hi. I was wondering, Premier, if you could speak directly to the letter you would have sent to the Prime Minister regarding the province being on the verge of going under. Could you talk about that specifically and why you felt it was necessary to send that letter? Yeah,
so we will release that letter. That was a letter that was written on March the 20th, and it was really concerning the situation that we find ourselves in financially and also where we are in this province dealing with the pandemic at that time. Things have changed drastically since then, as you know, but there was no question that I've been very consistent when I've been asked about the economic impact on Newfoundland and Labrador. We were in a difficult position coming out of the Snowmageddon, where we saw this province, virtually half of it, shut down for nearly 2 weeks. So it's been a very difficult 2020. We all know that this is not a province that receives equalization, and we all know that we were reaching out for months now for the federal government to deal with the fiscal stabilization fund. So we have not heard back. That has not been finalized yet, but I will say the accessibility to the Prime Minister and the Deputy Prime Minister is something. So these discussions are ongoing. So it was appropriate for me to put some correspondence in place. Nothing new to the Prime Minister. He is very much aware of the contents of that letter. So it's really just expressing where we as a province, where I would see it going, and the need for the federal government to look at Newfoundland and Labrador as a unique province when coming to the financial situation that we're in today, and we will find ourselves in coming out of the health crisis that we're currently dealing with.
Yesterday, the Francophone School Board announced that public exams would be cancelled, then later backtracked on that decision, saying that decision had been finalized by the province. Is that not the province's plan to cancel public exams? And if not, what is the plan for final exams for high school students? We will be making a decision now. We're currently working with the K-12 system, working with the school districts, and working with the NLTA and so on, to put in place, what the K-12 system would look like between now and potentially the end of the school year. Some provinces have made delays, for 30 days and so on. I've seen some just out yesterday till May 31st and so on. But we're working on a plan now and a program that will see us through the school year for the K-12 system. We're putting the final touches on that, and we should be able to make that. We should be able to release that publicly now within the next day or so. And also, you mentioned issues with procurement for medical tools, medical equipment. Has there been much thought in terms of using local companies, local resources in terms of helping that situation?
There's been a very active program, both provincially here and within Canada generally, to do that. And I know the federal government announced yesterday that they had 3 suppliers for ventilators and testing and so on that they had inked deals with. Locally here, we have a very active group, and that group is undertaking repurposing a manufacturing potential to look at gowns, particularly 3D printing for face shields, and also the possibility of gloves and masks. So we have that in train. Our regular order for the year went in at the beginning of January, and we've had some of that. We had a pandemic order that was put in at the end of January, and we've seen that serially delayed, but with some upfront deliveries on that. So there's lots of moving parts to this. We have our shared services group in Central looking at that in conjunction with the regional health authorities as well as private business. And then we're also linked into the federal initiatives, for example, about ventilator procurement in Ontario.
Thank you.
Thank you. The next question is from Ben Murphy from VOCM News. Please go ahead.
Premier Ball, CBC story today pointed out a pretty bleak and alarming economic outlook for the province, like Peter had mentioned earlier. Alberta laid off over 20,000 government employees over the weekend. Obviously don't want to have to lay people off, but with our outlook this bleak, why not lay off some of the almost 50,000 government employees and let the federal programs cover the expense like we've seen so many companies forced to do?
Yeah, well, the federal program would be the EI program that would be applied to some of our public sector workers, and that would be a substantial decrease in pay, as you know. So right now, we've made a decision to not lay off our public sector workers, and we have many that would be working from home. The decision that Alberta made, I think, to lay off teachers and so on, that was a different decision based on where they are. For us right now, we want to continue to work with, teachers, and as I said just a few minutes ago, there's some work left to do with the K-12 program for the remainder of this year. So right now, we've taken the position not to lay off our teachers, not to lay off our public sector workers. And of course, the federal program that we've seen out there, that not every program applies the same. If you look at the 75% of wage costs, that is not for government employees. So the only option that would be available would be the EI program. So that is not something that that's not a decision that we've made, and we want to continue, and we want to support our public sector workers. They do a valuable work. And as regards to our teachers, the school year and the K-12 program, we'll be talking a little bit more about that next within the day or so.
Dr. Fitzgerald, the CDC now says that as many as 1/4 of those infected with the virus could be walking around with no symptoms and transmitting it. Does this change our stance at all on asymptomatic transmission and that more testing should be done on more people?
So we have to remember there's two different categories when we're talking about asymptomatic transmission. There are people who are truly asymptomatic, and then there are some people who have what they call pre-symptomatic. So they have very, very mild symptoms and don't recognize them as symptoms. And those, certainly with that, we're seeing that people can transmit the virus in some of those cases. We do know that while the evidence now is showing that there may be some asymptomatic transmission, the majority of transmission is still happening when people are symptomatic, and that is the most concerning time with regard to spread. So, obviously we take that information into account, and we've looked at the way that we're doing things, and we've changed that accordingly.
And the numbers jumped by 23 today with no update on a link to Call's funeral home. Does this show possibly any more community spread?
No, we just, the reason we don't have that link is we just don't have those investigations finished yet, so we don't know if they're linked to calls or not, so we really can't say that at this point.
Okay, thank you very much.
Thank you. The next question is from Ross Lord from Global National Television. Please go ahead.
Hello, Premier. Now that our discussion from last week has been confirmed about payroll, I wanted to ask you, as you look ahead to post-COVID-19, as we all hope to look forward to the end of it, emerging into this economic crisis, how much discussion or how open would you be to the federal government taking over Muskrat Falls?
We'll have discussions, with the federal government. As I said, this is not a province that receives equalization. We've been working with the federal government along with Alberta and Saskatchewan and other provinces, with the support, by the way, of every premier in this country. They recognize that we are indeed a very different province, and we realize, and they all realize that without support of the federal government, and Alberta and Saskatchewan would be in a similar circumstance based on the reliance of natural resource revenue. So in our province, we've seen our revenues drop drastically. We've seen our operational costs that would increase as a result of dealing with this pandemic. So we're willing to have discussions with the federal government on what options that would be available to us, but we're not here to sell off the future of this province. That is not what this is all about. We're just looking for a fair deal, given the fact that we do not receive equalization. So there's many other provinces, by the way, that would be in a very similar situation if they were to cut these equalization transfers. So that is a big difference here. We just want recognition that those transfer payments are much lower in Newfoundland and Labrador, and we're just looking for support from the federal government, similar to the support that will be given to other provinces who would be in a similar situation if it was not for equalization.
So would you be willing to entertain, for instance, the feds having a greater share of offshore oil and gas revenue in exchange for them taking over, assuming the debt on Muskrat Falls, I guess, for which they're already a loan guarantor?
Too premature to be talking about. All I've said is we're looking for consideration, and we're looking for support from Ottawa, very similar to what the provinces across this country receive. In Newfoundland and Labrador, we are considered by definition of the equalization to be a half province. Well, indeed, if you live here, it doesn't feel like we're in a half province. And so right now, we're just looking for a situation that we can compare the amount of transfers that we get that would be relevant to Newfoundland and Labrador, very similar to what's happening in other provinces. I will say the Prime Minister recognizes where we are, the Deputy Prime Minister understands where we are, and the Minister of Finance federally, they know the situation of this province. It is very unique when you compare us to other jurisdictions.
Thank you.
Thank you. The next question is from Peter Jackson from The Telegram. Please go ahead.
Hi. I'm just looking for a little more clarity on the daycare measures being offered. It appears that home care family or friends who can provide this are now have an incentive. There's going to be a $200 per child incentive for them to actually take that on. But with daycare operators, it looks like you're still hoping for some of them to open. And given their intransigence in the past, is there any incentive or disincentive that's going on with respect to them?
They're already being paid. Child care operators have not seen any reduction to the revenue that comes from the provincial government, even though they are not operating. There's no children in those childcare spaces. So we've been able to support our essential workers. We must support our essential workers. These are people that go out the door every day to provide essential health care work and other services too, by the way. We have people out there in other areas of our province that are supplying essential goods and services to people to keep, our residents, could be keeping them fed, could be keeping them, providing the services that they need. Our healthcare workers are, of course, a critical group included in all of this. So all we're saying is let's work together. Let's support those workers as they provide those essential services every single day. They get up in the mornings, they work late at night, and they should not have to worry about where their children are. They should be able to make sure that their children are in a safe spot, and if that means that we need some support for our child care operators, I think that's only fair. And we're willing to work with those employees if they can find other ways of working with families and friends, people that they would trust, their neighbors maybe, and we'll support them exclusive of the operators, provide them with $200 a week if they can provide those arrangements. If not, in a very small number of children, we're asking our child care operators to work with us so that we can support our essential workers.
Okay, thank you. We had a transportation worker who noticed that at the gathering place in St. John's, where they're handing out meals, a lot of their clients are not distancing at all. They tend to be kind of commingling together, and a lot of these people are kind of vulnerable population. They might not have access to electronics or the media, that sort of thing. Is there any way that you're reaching out to get the government messages and the government orders to people who might be in that sort of situation?
We are very conscious that there are groups, and the gathering place is one, but not the only one, of individuals who are vulnerable. We have a special group within our department and across departments, actually, involving CSSD, Disability Policy Office, and folks such as that, who are actually looking at how we can do this. I sent a letter yesterday, I think, or the day before, to the gathering place, giving them some additional funding. We're looking through children, seniors and social development around making sure that children, for example, who would have got school meals, for example, through Kids Eat Smart or through the school lunch program, can also be accommodated as well. It is difficult with people who have challenges to get them to appreciate some of the constraints that Dr. Fitzgerald and the current situation have had to place on us. And obviously, it's going to take a little bit of sympathy and compassion, I think, to work through some of those difficulties. But if the gathering place or indeed any other organization comes to our group, we will certainly give them a very sympathetic ear and see what we can do on a very practical basis to help them with that.
Okay, thank you. And I do have a follow, but it's kind of a follow to someone else's question. That is, I'm looking at the light at the end of the tunnel, regardless of economic situation. What signs would actually indicate to you that some orders can be relaxed at some point down the road, and which ones would you relax first?
I think that would be a question that we in the department would discuss very actively with Dr. Fitzgerald's team. The facts of the case are, I think this is way premature for that. And what the situation might be in July and what the global situation might be by then will determine very much how we would approach that. We have taken the view from the outset that this epidemic, this pandemic, will be a long haul. And we've had some criticism around some of the things that we have not done around keeping what we would regard as services that are crucial open. And the reason we've done that is whilst you can do without a car repair shop for a weekend, you cannot do without it over a 3 to 4 month period. So it's going to be context, it's going to be day by day, but we're at the start of this yet. We've not even hit the surge.
Okay, thank you.
Thank you. The next question is from Drew Brown from The Independent. Please go ahead.
Hey, thank you. Ben Murphy took some of my material while I was in the queue, but that's okay. Basically, so I'm very happy to hear that there's going to be some pharmaceutical support for seniors in the months ahead. I was wondering if the province has any plans for assistance for people who, say, have been laid off and lose access to work-based drug coverage plans.
So there are drug coverage plans right now for people, if you look at the amount of prescription drugs that they would need based on their income. So, the minister just touched on a few of those just a few minutes ago, and can elaborate a little further. But we have a number of programs available to support those individuals or those families that would have excessive drug costs based on their income. So these are available, and also we have programs with inside government who have seen drastic decreases in salaries through income support and so on. But also there's a full suite and the full number of programs that are coming out from the federal government to support individuals that are laid off as a result of COVID-19. And so these programs are coming out with the criteria really on a daily basis. I know the Prime Minister spoke to that just about an hour or so ago. And I think there's an ongoing conference right now, press conference in Ottawa, outlining a number of the details. So I think two milestones here. Number one is April the 6th. Applications will be available that will go back to help answer one part of your question, Drew, but also for those that are experiencing excessive drug costs, there are already programs in place provincially to help support those families.
Perfect. Thanks. So my only other question is that in the past, when we sort of discussed this, the province's preferred position has been that pharmacists dispense up to 90 days of medication to people. But obviously, the Newfoundland Labrador Pharmacy Board and the local pharmacist association has directed that it's better to have to cut it off at the 30 days, and this follows the advice of the Canadian Pharmaceutical Association at the national level. So I've been hearing from a few pharmacists, and they're curious about why the province is giving some contradictory messaging between what they would like to see and what the pharmacy industry is actually doing.
We're not actually, I don't think, giving contradictory messages. I think we're dealing with a conflicting view of the situation. The drug manufacturers and the drug suppliers particularly have differences of what constitutes a shortage. I think the pharmacists associations, and I wouldn't want to put words in their mouth, their concern is around maintaining their ability to be able to dispense and are worried about hoarding and unnecessary amounts of drugs going out at a time where they feel they have shortages. From the point of view of the other side of that coin, public health are advising people to go out literally only when necessary. If under normal circumstances for medications, that's once every 90 days, moving that to once every 30 days is in actual fact not in the spirit of what public health have said. Certainly from the point of view of chronic disease management and system utilization, we, through the Medical Association and nurse practitioners and prescribers, have very much been keen on longer prescription periods for people who are stable, simply to reduce the demands on primary care and specialty care. So those are those tensions. Is there a right answer? Obviously, there's never going to be an answer that will completely satisfy everybody. And as long as we're talking about the issues with the pharmacy board, with the pharmacists association, with the wholesalers, and where possible with the manufacturers, I think that's the best we can do, because today's decision is the one that for each of us seems to be the most safe and sensible. Whether that's wise or appropriate or even possible in 3 or 4 weeks' time, we'll only know in 3 or 4 weeks' time, and we'll reconsider at that point.
We have about 10 minutes left, and we have 2 reporters waiting to ask questions. So we ask that you keep your preamble to a minimum so we can get your questions in. Thank you.
Perfect. Well, I'm finished, so that's good.
Thank you. The next question is from Holly Mackenzie-Sutter from the Canadian Press. Please go ahead.
Hi. We talked yesterday about how contact tracing is the focus now. So are you able to spell out the steps involved in that and how many people are working on tracing right now?
So contact tracing is being worked on by as many available communicable disease control nurses and public health nurses as there are available. And it is basically when we get a positive case, there's an interview process that happens, and they trace steps and look at the period of infectivity, and based on that then try to determine where people were and who they may have come into contact with and what the nature of that contact was. If the contact is deemed to be a close contact and a concern, then those names are taken and those people are contacted and advised that they have come into contact with someone who is tested positive. They don't release people's names in that process. They just say that there's been a contact, and then they follow up with that person to find out if they have symptoms and to advise them of the appropriate quarantine measures if they don't have symptoms, and to arrange testing if they do have symptoms. And then if they do have symptoms and they have their testing done, then they advise how the household has to behave until that testing comes back, and even after that testing comes back. So it's a process that happens that involves getting information, but also giving information and education about how to reduce the spread of COVID and how to protect yourself. And they're also informed of how to recognize if symptoms are getting worse and when they need to seek medical attention for their symptoms. So it's a fairly detailed and involved process that's happening.
Perfect, thanks. And I mean, with the example of the calls cluster, and funerals sometimes involve traveling, outside or into the province. So how does contact tracing work when there's potential overlap with another jurisdiction? And I'm wondering if it's possible that, the calls cluster could actually extend beyond this province.
So if they identify that there's somebody who is in another province, then that information gets relayed at the provincial level, and then there's communication between the provinces to give that information, and then the follow-up contact tracing will happen in the other province or territory.
Okay, thanks. And I'm wondering, with regards to healthcare workers in isolation, do we know how many have tested positive as of today?
My understanding is that across Eastern Health there are only 10 workers who have tested positive. I've not been made aware of any in any other jurisdiction. Again, some of the details from today's new cases may alter those figures.
Thanks. And just one quick question. So I know you said that as many
You've
as
had
possible
your three
working.
questions. We have one more reporter who's waiting to ask a question, and we have 5 minutes left. Thank you.
Thank you. The next question is from Elizabeth Whitten from All Newfoundland, Labrador. Please go ahead.
Thank you. Dr. Fitzgerald, you work with 5 medical officers of health who represent different areas, and I'm wondering, how has the pandemic changed your interaction with them?
So we are interacting on a regular basis. The medical officers of health that are in this province right now, some of them are new to the province, and some of them have been here for a little while, and some have come back after being away for a little while. So we are interacting on a regular basis. So we meet several times a week, and we have discussions outside of that whenever we need to. So, and these are normal ways that we would communicate if there was any kind of outbreak, and it's perhaps a little more involved at this with this pandemic.
Perfect. And has your previous work as a family doctor helped you in your work in public health, particularly recently with the pandemic?
Well, I think work as a family doctor helps you in a lot of areas of medicine, certainly from knowing how things can affect people on the ground. I think it gives me a good insight into that. The policies that we make at a governmental level or at a provincial level, it's easier sometimes to see how that might affect people on the ground. And I hope that through my experience as a family doctor that I have found a way to communicate with people that is effective, and I hope that that is effective in this regard as well. So from feedback that we've gotten, I feel that it is, and I think that it has had a very positive effect on my ability to do this job.
I think Dr. Fitzgerald is way too modest about her assessment of the experience that she's learned in community practice and her engagement with her colleagues across this province. She's doing a remarkable job in my assessment, and the feedback that I'm getting from people in our province is that her communication skills and the experience that she's had, regardless of what stage in her life that would have been, that she actually speaks to Newfoundlanders, she speaks to their families, and she is speaking to health care providers across this province. So I give a big shout out and a big thank you on behalf of everyone for the great work that Dr. Fitzgerald is doing.
Oh, that's my question. Thank you.
Thank you.
Thank you. The next question is from Peter Cowan from CBC News. Please go ahead.
In other provinces, we've seen modeling about how many people there might actually be who have the disease. Obviously, not everyone is going to get tested. Do we have any sense of how many people might actually have it rather than just how many people have tested positive?
The data for Newfoundland and Labrador is being analyzed actually as we speak with a variety of such ideas in mind. The challenge is that the models that you create are based on assumptions, and those assumptions have to be tested in reality. So how infectious is this disease? How many people will one person infect? Is the fact that 30% of people in an area in China actually had COVID-19 relevant to Newfoundland and Labrador? We are a territory. Once you get west of Fairhaven, does that play into it? So all of these things are questions that we are asking. And I think the analysis of what's happened in the first couple of weeks will certainly help inform what's going to happen over the next couple of months or even longer. I'm not sure how relatable Chinese experience and data is when you translate it into the Canadian context. And I know that there's been some challenges at the federal level with getting the data in a format where it's the same across the provinces. Dr. Tam last night on our conference call was talking at length about that. And we hope through the Canadian Institute for Health Information to be able to produce some national models over the next little while. But if we produce a model and the model is flawed, then that's not going to help anybody, and that's not going to inform. It could either generate panic or generate a sense of complacency. So the important thing from our point of view is to try these models and then see what it looks like and see if the model is actually an accurate representation of reality. But at the moment, you can go on any website almost or any phone app and you can see anything from, this is nothing worse than the flu to the apocalypse. And there's no scientific validity behind it at the moment. So the short answer is we're working on it. The longer answer is it may take a lot longer to get a decent model than you think.
Can you provide a little more clarity about who is actually going to be eligible for having their dispensing fees covered?
Those seniors and low-income people who are on the currently on the foundation and the 65-plus plans are the ones for whom government has a responsibility for coverage. They are our most vulnerable, and they are the ones that we will provide effectively 2 dispense fees in a 90-day period to top up so that they are not out of pocket. Current estimates on that group alone is it will cost government an extra $3.5 million, assuming this is over by September.
And finally, quick question for the Premier. You mentioned that food rationing doesn't make sense, but we've heard from the Atlantic Retail Council that stores are in a better position to be able to make decisions about what their supplies are like. So why do you feel that, I guess, you're in a better position than stores to decide how much food people should be able to get?
Well, when you not in a better position, I'm just speaking to, as I said yesterday, about food distributors and grocery store operators within our province. I spoke to them again yesterday after our call. So when we see, and I think the minister was out yesterday talking about the limitations on milk and so on, we have supply management within our province around milk, around chicken, eggs, and so on. So these are supply managed within our province. So right now, based on the assessment that's been done through the Department of Forestry and Land Resources, which includes agriculture, and which would include, you know, the work that it does with milk and dairy producers. So right now, the assessment that was done by the minister, as he explained yesterday, that there was really no need to be restricting milk products, you know, within the grocery stores. So I've had conversation with those owners as well. And, you know, right now, what we want to be able to do is reduce the number of trips to our grocery stores. So if we put restrictions on those, you know, those items that we have in supply management, well, that is counterproductive to what we're trying to do. Now, I will say that that when you'll see some grocery stores, you might see some vacancies and out of stocks, but the main SKUs, the main items that's required for people, and these are through you know, shopping habits that are determined by those store owners. The majority of products that they use on a daily basis will be available for shoppers, and we once again reiterate make as the least amount of stops to our trips to the grocery stores as possible. This has reduced congestion in the stores.
Thank you very much for tuning in. The time for questions has ended.